In the ongoing COVID-19 pandemic, morbidity and mortality has mainly been seen in adults. In India, less than 12% of all confirmed cases are in individuals who aged less than 20 years, which is approximately 41% of the total Indian population. In the expected third wave, disproportionately a high burden predicted among the pediatric population, as more than 60% of children are vulnerable because there are no vaccines for children yet in India, and reopening of schools and colleges may contribute an increase in infections among children. I am Dr. Arijit Banerjee, and in this video I will discuss about the symptoms, treatments, management and preventive measures against COVID-19 infection among children or pediatric age group. So stay tuned with me and subscribe the channel and press the bell icon to get latest authentic health related updates. Why children are vulnerable? As per the available serosurvey data prior to the launch of vaccination drive, children who age between 10 to 17 years had seropositivity similar to that in adults, that is 25.3%, which means that children are as susceptible as adults to infection. National and international data indicated that 2 to 3% of children requiring hospitalization in wave 1 and 2. But it is expected that third wave, the figure may rise up to 5% who needs hospitalization. Scientists have found children with comorbid conditions have more severe manifestations and poor outcomes. They should be prioritized for vaccination. As there is no vaccination for this kind of age group, it becomes a matter of concern. Again, as per the National Neonatology Forum of India, that is NNF India, the incidence of COVID-19 in pregnancy is similar to the general population, but the manifestations are more severe. During the first wave of pandemic, the test positivity rate among hospitalized pregnant women varied from 5% to 12% in the centers, whereas it went up to 20% and more in the second wave. Among the neonates born from SARS-CoV-2 positive mothers, the incidence of positive test ranges from 0.5% to 13%. Most neonates with early onset infection remain asymptomatic or mildly symptomatic. Among those who are symptomatic, the manifestations are usually related to prematurity and its complication. Neonates with late onset of COVID-19 have relatively more profound clinical features and can present with pneumonia, diarrhea, fever, and other organ involvement. Among the symptomatic children with COVID, fever and respiratory symptoms are the commonest symptom. The children may have other symptoms also, such as GI-related disorders like diarrhea, vomiting, etc. The severity of symptomatic pediatric COVID illness ranges from mild to severe. Symptom includes for mild, sore throat, rhinorrhea, cough, and no fast breathing. Moderate symptoms included fast breathing, which is age-based. We have to remember this is breathing, not heart rate. More than 80 per minute where the age is less than 2 months. More than or equal to 50 per minute for 2 to 12 months, more than 40 per minute where age within a range of 1 to 5 years, and more than or equal to 30 per minute where age is more than 5 years. If that kind of fast breathing observed, we can call those patients as moderate symptom for COVID-19. Severe symptoms include severe pneumonia, ARDS, sepsis, septic shock, pneumonia with any other condition like cyanosis where SpO2 is less than 90%, increased respiratory efforts, lethargy, seizure, etc. What is MIS-C? Multisystem inflammatory syndrome in children, or MIS-C, is a serious condition that appears to be linked with coronavirus disease or COVID-19. Most children who become infected with the COVID-19 virus have only a mild illness. But in children who go on to develop MIS-C, some organs and tissues such as heart, lung, kidney, digestive system, brain, skin or eyes become severely inflamed, which need immediate intervention in hospital. Symptoms of MIS-C includes fever that lasts 24 hours or longer, vomiting, severe abdominal pain, diarrhea, skin rash, feeling extremely tired, fast heartbeat or rapid breathing. If your child has any of the warning signs or is severely sick with other signs and symptoms, get care immediately. Take your child to the nearest COVID care center or hospital as early as possible. Children with asymptomatic or mild COVID-19 can be managed in home isolation under direct care of the parents and family. Symptomatic treatment for fever, adequate rest, good food and diet, and continuous monitoring of saturation, that is SpO2, pulse and respiratory rate is enough. But parents need to know about the danger signs for progression of disease. As mentioned before, children with moderate and severe condition need immediate medical support without further delay. Children who need admission should undergo a RAT, that is rapid antigen test, followed by RT-PCR as confirmatory diagnosis. In most of the cases, it was found that unfortunately lack of awareness among parents causes COVID infection among children. So parents need to be very serious while dealing with their children. Properly wearing a mask in public areas, maintaining a good social distance and following hand wash could save us. We should remember that COVID is still very infectious and we shouldn't let our guard down. That's all for today. Subscribe the channel, like the video and share with this information with your friends and family. Take care.